days, menopause treatment isn't what it used to be. It's safer, more targeted, and doctors better know how to keep your body healthy. Today, in Your Health with Bellin, a conversation about it with Dr. Kristin Lyerly.
Menopause is the absence of menstrual periods for greater than a year. It may occur in your 40s or 50s, but for most women, the average age of menopause is 51 and a half. The most common cause of menopause is that your ovaries just stop working. As we get older, our ovaries just kind of peter out. Other common causes of menopause, though, are hysterectomy with removal of the ovaries. Another common cause of menopause is medications. If you're being treated for especially a cancer, that can really knock the ovaries out too. I think the most common symptom that women have is hot flashes. Night sweats are also very common. Irregular bleeding can be very troublesome and very common as well. Mood changes, sleep disruption. Going through menopause, you start to lose your natural estrogen when the ovaries aren't functioning normally anymore. Estrogen is really important for our bodies. It helps especially with bone health. So taking enough calcium, enough vitamin D, making sure that you have a good diet, that you're getting enough exercise. And ladies, exercise is so important to help maintain good bone strength, especially if you're at risk for osteoporosis. Menopause can also be a time that's very important for women to consider their cardiovascular health. Heart disease is the #1 cause of death in women. So really thinking about maintaining that regular exercise regimen, eating well, ensuring that you're having your cholesterol checked on a regular basis, that you're being screened for diabetes, and that we're looking at your family history to make sure that we take care of any problems that we might be able to foresee. As our metabolisms start to slow down, we don't have our normal hormones present. It's common to start slowing down, both physically and with regards to our metabolism. So many women do put on weight as they go through menopause. We can fix this with diet changes and with exercise. There are many different kinds of treatments available for menopausal symptoms, and the treatments are directed at the symptom itself. It used to be, in the olden days, that we would just give women estrogen. We would just give them hormones and say, you know, good luck, this is what we do for everyone. Well, we have learned a lot since then. We've learned that we need to be really smart about how we use hormones, and that when we use hormones, when we recommend them, they can be very useful, very therapeutic, and very safe. We can use SSRIs, such as paroxetine, to treat the hot flashes and mood symptoms. We can use vaginal estrogens, vaginal lubricants, vaginal moisturizers to treat the vaginal dryness that often accompanies perimenopause and menopause. Just because a therapy is right for you doesn't mean it's right for her. So understanding the risks and the benefits of each of these individual therapies is critical to finding the right answer for you. When you're in that period of time, your peak reproductive time, there are so many amazing things that can happen, that you're so active and you're raising a family and you're busy, you're taking care of your parents, you're taking care of your kids, you probably have some sort of either a job or other commitments. It's such a crazy time. And you get to menopause and you're kind of getting away from a lot of those strings, and then you can start focusing maybe a little bit more on yourself. But then some of these physical things happen, and it is so important to be able to recognize what's normal, what's not, to make sure that we're doing all the important things to screen for cancers and other preventable diseases. It's really actually pretty easy to keep you healthy.
For more information, visit Bellin's website at bellin.org. You can also get info and make appointments 24/7 by calling 920-445-7373. That number is also available on our website. Coming up